Today in this video, we will discuss about ultrasound findings of kidney. This is a normal right kidney which shows no stone, no hydronephrosis, normal in size. When we compare the texture of liver and kidney, you can see the no parenchymal change is seen in right kidney. When we look at the second video, you can see the calculus of 24 seen at right renal pelvis. So this is a calculus of 24 at right renal pelvis. So no parenchymal change or hydronephrosis is seen in this video. Now look at the third video, which shows a small renal cyst. This is a medullary tiny simple cyst and a stone of 19 seen at upper pole. So this video shows two findings: renal cyst and renal stone, simple renal stone, cortical cyst and medullary cyst. So the cyst that involve the medulla is medullary. The cyst that involve and the cortex that is labeled as cortical cyst. So this is a tiny medullary cyst. Another calculus seen in right kidney at mid pole. The stone always present with the shadow. So on the next video you can see this right kidney with hydronephrosis. Hydronephrosis with proximal dilatation of ureter. So this is labeled as Hydronephroureter stone. So proximal dilatation of ureter, hydronephrosis with hydronephroureter. In next video you can see the kidney with multiple large cysts. These cysts are not normal, so this is very large multiple cysts are in periphery range. So this is polycystic kidney involving the parenchymal chain. So in this video you can see the right kidney. When we compare the texture of right kidney with liver, you can see the enhanced synchrogenicity. So the parenchymal chain seen in this kidney. In earlier videos you have seen the texture of liver and kidney that is normal. So enhanced synchrogenicity of right kidney lead to parenchymal change.